And I'm Hunter Brophy, and today we're going to be talking about Duchenne Muscular Dystrophy.
So, DMD is a genetic disorder that progressively degenerates muscles due to a lack of dystrophin, which means their muscles get very weak. So, because of this, their calves will be enlarged, and they will seem very clumsy when they're children, and they will try to compensate to their clumsiness with poor posture. Wheelchairs are usually needed starting around 7 to 12 years old, and a weakening of the heart and respiratory system can occur because they are also muscles. Because of this, things that seem very trivial to us, like colds, can be very hard. If I was a person with DMD, I would find it very hard to cough and get over colds because of this. I would also probably experience headaches, mental dullness, difficulty concentrating and staying awake, and possibly nightmares. Someone my age would also be in a wheelchair by now. I would most likely be in a special education class to help with my verbal learning and memory and emotional interaction. And I wouldn't be able to do some of the things I love, like play my violin and stuff like that. And I would most likely be halfway through my life by now because life expectancy is only early 30s. Treatment, like most genetic disorders, there's no cure, so they focus on treatment of symptoms. Doctors encourage standing to promote circulation to muscles. Patients, but they usually have to use braces to keep their muscles and tendons stretched, and wheelchairs are also used to move around. It's important to know that they might have an adverse reaction to anesthesia if they have to go in to the hospital for a related or unrelated medical condition. But scientists are currently trying to use viruses to replace damaged versions of the gene with healthy versions.
So the occurrence is, it affects 1 out of every 3,600 males, and in the U.S. there's 151.8 million males. And so out of those, it would affect approximately 42,166 people. Females are really affected by it because it's on the X chromosome and it's dominant recessive, so if you have a bad version of the gene, the healthy version will cover it up, but females can be carriers. And so for a female to have the disease, a female carrier would have to reproduce with a male who has the disease, which is very unlikely to happen, and I'll explain that later. And your mutation happens on the X chromosome. It's actually coded by the DP427 transcript, which is one of the biggest genes in your body. And it produces dystrophin, which helps keep your muscles intact. Without dystrophin, your muscles slowly start to fall apart because it keeps your muscle fibers connected to the cell membranes. And here's our Punnett square. So the big M means you're healthy, the little m means that's the gene for these disease. And we did cross a female carrier with a healthy male because with the males there, and if you have the disease, you're in a wheelchair by the time you're 7 to 12 years of age, and by the time you're in your 20s or early 30s, you're not really functioning properly. And so you have a 25% chance to have a child that's a female that is a carrier, and a 25% chance to have a male with this disease. And that is our sources.